Hi, everyone. We're going to start off by saying good morning. I'm sure for some of you it's not the morning, but for most of you, at least in the US, and certainly for Aimee and I here on this wonderful day as we start this amazing masterclass and Day of Experts, it is the morning. So we're going to start there. I am Dr. Marc, the fertility expert. This is Aimee Raup, the author of Yes, You Can Get Pregnant. Aimee, say hi.
Hi.
So we're here to bring you an amazing day with amazing speakers, amazing knowledge, and really what we hope is like setting you all up to be successful in this 2017 year to get pregnant. And so Aimee and I sat down probably 6 months ago and said, what could we do to support people in 2017? And we came up with this awesome idea, or at least what we think is an awesome idea. So we're here to bring you the Integrative Fertility Masterclass. And we've got a whole slew of speakers today. So what we're going to do in this first segment for all of you is Aimee and I are going to kind of summarize and wrap up all the speakers, highlight some key points that we wanted to talk about, and then we are both going to talk about and go into a little bit more detail on miscarriage and autoimmune issues, and why we think that's so important. And it's not covered in any other of the lecture topics today, so we're going to do that. And then hopefully all of you are able to stick around for the whole day and join us for the live Q&A with the majority of our speakers at the end of today. I won't say the time because it's going to be a different time for everybody. But hopefully it is the last thing that we have planned for today. So hopefully all of you can join us for that. And if you're not able to join us for everything today, we are going to record the live Q&A, and everything will be able to be listened to and played back later on today and tomorrow as well, at no charge. And then if you do want to listen to it beyond that, certainly up to you, but then there is a small fee for that as well. So Aimee and I are excited. I'm going to stop talking and turn it over to Aimee for a second.
Hi, guys. How are you? As Marc said, we're just thrilled to have you all here. And, Marc and I have known each other a long time, and we share a mission of helping all of you optimize your health and your fertility so you can get pregnant. And we thought, what better way than to pick the brains of people that we consider experts as well, people that we follow that are peers of ours, and ask them really important questions on, what can we share with women so they can best optimize their health and make 2017 their year to get pregnant. And it's like exciting to me, so exciting. I get emotional about it, Marc too. It's just, there's so much information. And even, us, we've been doing these interviews with these amazingly intelligent women and men. There are a lot of Aimees in this group. And we have two men, but I've learned a ton. I was taking notes in some of these lectures, right? And Marc as well. And each interview brought with it its own knowledge base that, is no matter what, if the PCOS diva, if you don't have PCOS, you're still going to learn a lot from that lecture. So I would highly recommend it, and if, you're not that connected to the mind body stuff, I would still recommend, watching, every single video that we put together, because to us, it's each facet is that important for you to understand. And it takes all of these facets together to really help optimize your health and fertility. And a big conversation that we had with Dr. Magarelli was about, in Chinese medicine, the mind and the body are not separate, right? We've never seen them as separate. They've always been whole. And how he's integrated his approach from a Western medicine perspective, with the Eastern, and understanding that the mind and the body come together. So what we've chosen for you is extremely intentional, and, listen to all of it, take it all in. If you have the resources, purchase the videos and watch them again and again, because you're going to hear a different thing every time, and you're going to gain knowledge, in different ways, and hear things differently. So we hope that this really helps you get to where we want you to get, which is healthily pregnant in 2017. And then when you do get pregnant, you better message us and send us pictures.
Let us know.
Positive pregnancy test. I want baby pictures. Names. Marc and Aimee are really nice names. Ask Kidding. No.
That's funny. And actually, with those names, you have a plethora of ways to spell them, by the way.
Yes, there you go. We have 3 different Amees that we're highlighting here for you.
And they're all spelled differently.
Yeah, every one of us. I'm being facetious, but just with the intention of, we're so confident that this knowledge can help you. And if you've been trying and nothing seems to be working, that, what we hope to bring to you is the means and the resources to be your own advocate, to ask for the support and the help that you need, to get the right tests done, because fertility, like any health challenge, requires detective work sometimes, and if what you're doing hasn't been working, then something needs to be looked at, right? Something needs to be tweaked. It could be simple and it could be, big, but we're hoping to give you all the resources that you need so you can become your own advocate and really, optimize your health and your fertility, and to realize that you have a lot more power in this situation than you think you do. And you have a lot more power over your health than you think you do. And your health and your fertility are not separate, and so with that said, we get into, each of our speakers. So we,
Can I piggyback on something, Aimee, real quick?
Of course.
You had said something which I think was awesome, because I think when people see the topics and the list of speakers, they might say, oh, well, I don't have PCOS, so I don't need to listen to Aimee Medling, the PCOS diva, on what she has to offer. And you might say the same thing when you see that Nat and all 3 of us were talking about endometriosis and so forth. And, oh, I don't have endometriosis, so I can skip that lecture. I think all of you will find something very powerful, life-changing, hopefully fertility-changing, and really meaningful in each one of the topics, even if the title doesn't resonate with you. So if you don't have PCOS, we would still encourage you to listen to the whole thing, because there's so much valuable information shared just in that lecture alone. And if you just ignore the title or the words when we say them, PCOS, you're still going to gather tons of information. And so let's not be closed-minded to any one of those things. Let's keep our minds open. There's so much information. And like Aimee said, Aimee and I learned a ton of information as well during all of these lectures. So we have to imagine, if we learned it, you all will learn tons of information as well on your end. So please tune in, listen to all of them. You will learn something valuable from each one. And that will make you be a better advocate for yourself and have more resources for yourself to be, a better person, have better health, and hopefully better fertility. So,
yeah. And one of my favorite parts too of doing all these interviews was, our favorite question that we asked all of the speakers was, what is their passion behind why they do what they do? And, if you want to be inspired, right? And if you all 7 of us, right, we help women, and their partners affect radical change in their health, and then help them bring babies into this world. I mean, it's really fascinating and mind-blowing. And to just, take in those lectures from that place of understanding that each one of us has a passion to help you and a strong desire, and that, all we want for you is to succeed at this. And all we want for you is, to have the healthiest body you can have, and a fertile body and a fertile mind, and to allow, that life to grow inside of you and flourish. And, even with, like Marc was saying, with Aimee Medling, we talk about PCOS, but that lecture was so much more than that. We're talking about diet and managing blood sugar and how that's super important to health and fertility, right? And with Nat, talking about endometriosis, but so many women are walking around. I think that's one of the most common causes of fertility challenges, and it's not properly diagnosed for the most part. You need a laparoscopic surgery typically to get the diagnosis. And we even talked about that, like, is surgery the right option? And we all agree, that sometimes it is and sometimes it isn't. And, so we really get into it, but even just seeing what your symptoms are and how you can manage that. And maybe there are some indicators that there is endo in your body, and how to just tame that inflammation so your body becomes more hospitable and can achieve pregnancy. Yeah. So yeah, it's like there's so much in each lecture, and I don't know. I'll let you.
Yeah. Well, I was, you mentioned Nat and the PCOS diva. So I'll kind of touch a couple of things that I really enjoyed about there. It's like, I think the thing for me about Nat's interview, and one is anytime you speak to someone in a different country or in certainly different, she's halfway on the other side of the world, right, in different hemisphere, there's just a different, culturally, there's just a different take on how they approach things. And so I think that's really refreshing. I think Nat's approach with her patients was really nice to listen to and hear what she had to share about how she likes to listen to patients and guide them through things. And, some of it's a little bit of tough love too, right? You've got to share some things that, aren't so nice, but you've got to push them in the right direction so that we're all empowered to do more for ourselves. So I really just enjoyed that fresh take from her and what she had to offer during that lecture. And then the PCOS diva, I actually met Aimee and Nat the same weekend event that we were all at. So it was fun to meet them both. Although the three of us didn't talk together. So, maybe next year we'll do that all three. But, just hearing Aimee's, like, where she's been and how she got into this field and why that drives her. And she's really become so passionate about PCOS and really helping women figure this out. I mean, it's like the biggest endocrine issue we face, and it's so often overlooked and completely mismanaged. And Aimee just brings some real practicality and simplicity to how she talks about it and how she wants patients to deal with it. So those two things were really refreshing to me about those two topics.
Yeah, and Aimee's, and I say this lovingly, is a real nerd, right? And she loves the science behind it, and she delivers that in such a concrete, precise way. Like, I was literally taking notes where I was like, oh my gosh, the way she says it is perfect. And so well researched, and just interesting about, using the ovasitol, I don't want to give too much away, but is just as effective as metformin, right? So for all those out there that are considering or going on, that there's a natural treatment option as well. And again, we get into it all. Even Aimee Valpone's interview was great too, because she talks about her own personal struggle, right, with what she went through from a hormonal imbalance perspective, and all the doctors she met with, all the tests she did. And, she literally saw everyone under the sun, right? And what's working for her now is the minimalist approach, right? Where she's not really on any supplements, and it's just clean eating and some acupuncture and some other energy work. And that's what's working for her body to bring it back into balance. But she shares her, she's a best-selling author and super intelligent about especially food and healthy eating. But she shares what she went through and how she got to the other side, and what she even learned, that even the health experts learn a lot about their own health when they're going through, any challenges. And so I love that, lecture. And then Nita Ewald's lecture, which is a bonus, right? If you purchase, you get that one. I love Nita. Marc loves Nita too. She, we love all of you guys. But she's so smart. I think she has a PhD in chemistry, and she's a chemist by trade, but she went through her own fertility challenges, and with that learned how to overcome it. She did go on to get pregnant, and then she also adopted a child. And we get into the liver and how to support its detoxification pathways. And we talk a lot about the MTHFR, the genetic issue that you can have, and so your body can't absorb or can't take folic acid and make it into folate, and can render you with lots of deficiencies that then don't allow for pregnancy to happen, or if you do get pregnant, that the child could have some challenges. But anyway, it's I love talking with Nita too, because the same thing is like even with Aimee and Aimee, overcoming their own challenges, right, and learning so much through it, and it's completely changed the course of how Nita practices and what she even does, right? She's doing functional nutrition with her clients, and she knows so much about food and how to best support the body in doing what it needs to do. Like, that liver needs to work properly in order for your hormones to stay in balance, in order for fertility to thrive, and yeah, she really gets into it. So I, would love for you guys all to be able to listen to that lecture
I
too. She's
agree.
super smart. And
Yeah. I really, it was interesting for me because, Aimee Valponi better than I do, obviously. And everyone, it's not a secret. Uh, Aimee treats Aimee.
yeah,
And
she's become a patient of mine. Yes.
she's become a patient of hers, and she states it in the interview, so it's not a secret. So I'm not,
Yeah.
I don't have to worry about saying it. But
Not violating anyone's
right,
right.
so Aimee obviously knew her much better than I did, and so that was the first time that I had spoken to her and met her, and it was really powerful for me to hear her journey. Right, like she had been on all these things, she was seeing all sorts of providers, and now she's just doing. It's all about simplicity for her. And I think that there's a lot of patients that's what's necessary, right? That's kind of the art of working with a patient, seeing what they've done and where they're at. And then there's lots of patients who they need more support than what Aimee Valponi's at, because they're in a different place. You need to approach things differently. And I think the beauty of listening to all of these is that, whether you're working with Aimee or me or one of the other wonderful speakers in this day, like every one of us has a slightly different approach in how we manage patients and how we work with you all. And it doesn't mean that there's a dogmatic one way to work with everybody. There's, you all need something slightly different, and you're all going to gravitate towards something different that works for you. I mean, Aimee Valponi found Aimee Ropp for a reason, right?
Yeah.
Because that's what she needed right now. And this was the direction she needed to go today, or, this year. And so I think that was really powerful, hearing her journey and kind of all the struggles and ups and downs and where she is today. And I really, I couldn't agree with you more. I loved Nita's talk about nutrition and, the liver and detoxification. It's super powerful. Plus, it's something that we get asked and discuss all the time with all of you. So we thought it was going to be a super valuable thing to offer. And we actually threw it in as a bonus because we didn't plan for it, but we felt like we needed to put it in, and we didn't have time for it in the day. But we decided to put it in as a bonus for all of you. So hopefully you're able to take advantage of that and utilize that. I think for me, to kind of round out, even though we talked about the mind, body, and the emotional component in almost every lecture, I think, if not every one, the way Sarah brought it together for everybody, and to be able to obviously her specialty, and to be able to pick her brain on why these things happen and how she puts it all together for patients and using EFT, I thought was just really refreshing. Yeah.
Well, I got so excited during the interview. I kind of went off cue and I was like, can we do some tapping now? Yeah. I threw her off a little, but she's giving you guys a great bonus, where she's going to give you an intro to tapping, and there's some video for you on how to tap. And I've used EFT before and really am diving into it more. I think it's amazing. And it really seems to help women unblock any of the emotional fears or blocks, to be redundant, that they have from becoming a mother or overcoming a miscarriage, being afraid to get pregnant again, right? Or believing in their body. And yeah, she herself too, right, went through fertility challenges and overcame them, and uses the EFT now in her practice all the time. And what's beautiful is she could do that from anywhere in the world. It's so great on Skype,
Great.
But yeah, she, again, well-founded, research, super smart, and passionate, and so loving and caring and really supportive. And I think too, that was, you touched upon it just before, but every patient requires something different, right? And it's always comes to them at the right time. And if there's one big take home that we have for you, it's to find the right support, right? And to work with people that you resonate with, and so, and that might change. At one point you might resonate with one person, and then you shift out and resonate with someone else, and that's okay. Yeah. Or at some point, taking a certain supplement didn't resonate and now it does, and that's okay. So, the most important thing is to get the support, but to listen to your body and get to know what it needs, and it can tell you. We both went to the same school, Mark and I, and the one take home that I always have is the patient knows what they need to be healed. It's what my job is and what Mark's job is to be able to listen so we can actually tell you back. You know, we can repeat it back to you, like this is. And so although, you know, during the Q&A, we can get that opportunity because we're live, but in all of these recordings too, to just really listen and see what resonates, what hits home, like what do you feel in your heart, like that feels good to me, or that doesn't feel good to me, and to listen to that. And I thought Sarah's lecture was just wonderful, and it really does hit home, and she's giving you some awesome gifts to take this to the next level. And the emotional piece, it can't be stressed enough how important it is. You know, if you're not connected to that piece, you might be able to get pregnant, but I feel like you're not going to have all the benefits you could have if you were spiritually connected and rooted in yourself.
Yeah, absolutely.
Who else? Who are we missing?
Well, we're missing the one, we actually did it yesterday.
Oh, right.
Dr. Magarelli. Yeah. And I think I think you're going to find it really informative. And I think you're going to find him really refreshing. I've known Paul for quite some time, and he's funny, and he's charismatic, and he's very caring. Certainly has his specific take and, you know, approach to things, because he is talking about IVF and, you know, why IVF is awesome, right? I mean, because that's his take, and it certainly has its place. I think the thing that jumped out for me, and I've spoken to Paul many times about it, is that he's a huge proponent of integrating natural healthcare and acupuncture into his IVF cycles, because he's just trying to incrementally increase success rates, right? But when you listen to his talk, and I'm sure everyone will come to a point, because I put myself in your shoes for a moment while I was listening to him, and I felt that way, was he's going to talk and he's going to mention, you know, okay, so this is IVF and this is where we are today, and these are the success rates that we're getting. He's going to make it sound like pretty much anyone who does IVF will be successful and have a pregnancy, and that IVF, he didn't say 100% success rate, but he made it feel that way, right? And I just want all of you to understand that it's not for everyone, and there is no such thing as 100% success rate. Okay. And even with all of the advances that they have today and the improved success rates that they have today, it's still not, you know, 100%. And so I just don't want you guys to take that away from his lecture, because I thought there was a lot of really useful information about what he had to share in terms of like, what is an IVF process? How does it work? And so forth. But, and there's a lot of practical things to take into perspective when you're looking at that. And he offers wonderful resources, but I just don't want that to be like the guiding point that everyone takes away from it.
Yeah, and I mean, I think that's a wonderful point. We really brought him on, you know, of course, to explain IVF to all of you, but also because he's such a big proponent of integrative medicine, certain supplements to help with. Okay, sorry, my connection, it just said it was unstable. Okay,
yeah, it's okay, we're back.
Okay, hi. No, that, you know, he really is wonderful at integrating the medicines, and, you know, and we love that. And of course, yeah, he's an expert at what he does in his field. So he's a huge fan of IVF and believes that, you know, it can help many women, and he's helped so many, right? And he makes it affordable. And I mean, it's brilliant. So if that's the path you're on, I think beyond, you know, it's worth doing. He's offering everyone a free 20-minute consult, like 100% do that in a heartbeat, even just to collect more information. He's a super individual, but to also keep it in mind that, you know, he's a Western practitioner coming at it from a Western perspective. You know, he's a PhD, MD, so those types are real smart. I mean, everybody's really smart, but I mean, the way he thinks, it's a numbers game, right? You know, so to keep that in mind, because you are you, and every individual is different. And again, if it resonates with you, then that's probably for you. If it doesn't resonate with you, that's okay. But I'd still listen to that lecture, because he had some really great talking points, and he, like you said, it was my first time meeting him, and he's very warm, charming, charismatic. You know, he's wonderful. Like you want to work with him. If I needed to have a doctor for IVF, I would probably go to him after just talking that one hour yesterday. Like I was like, he's on your team. Like he believes in your body. And he, you know, those are some great take homes. He said, you know, nature knows how to do this. Your body knows how to get pregnant. We're just here to kind of egg it on and remind it. And that's one thing Marc and I talk about all the time, that nothing's broken, right? You just might be on this side of the spectrum, and we just kind of need to nudge you over a little bit. And he has the tools to do that, and so do we. And you know, I think all of these lectures combined will really give you, as you know, a lot of tools to help improve your fertility and get you into a place, whether it's to try naturally or to do IVF. It doesn't matter. The work we do is still get you as healthy as you can be, so that you can respond well in an IVF and create great quality eggs and have a, you know, harmonious uterine environment, so that fertility, you know, and pregnancy happens. So just to take all of that in. And yeah, we don't want to overwhelm you. We are throwing a lot of information at you, but that's why I think it'd be nice to just hear it and then hear it again, you know, listen. So even if you're doing this live today, then listen again tomorrow. They're the ones that you're still thinking about when you wake up in the morning, you know, take the time, and, you know, that you're worthy of the time to take to listen to this and to take it in, and follow some of the recommendations that we're making across the board.
Yeah. You know, on that note, Aimee, I wanted to talk about, Aimee and I, we had a couple of things that we wanted to mention in addition to kind of just recapping, but I wanted to just say, because we talked about Dr. Magarelli, and I think it's a good point to kind of say, you all need to get the support that you need and that you deserve. And if you're working with a provider, whether it's natural or IVF provider, that's not giving you the support you need, then, you know, don't feel like you have to stay stuck there. You know, go find someone who's going to support you and give you the resources, tools, and guidance that you deserve and need. And I think that was one of the valuable things about Dr. Magarelli's talk, is because he's there for you. He's going to have his take, whatever it is, but like, he truly is part of your team. And I've worked with tons of clinics all over, and, you know, there's doctors and clinics that I don't feel are part of the team. Like, they're just there. It's their job. They wake up that day, okay, this is what I have to do. And he's not one of those. Now, does that mean you should be working with him? Not necessarily. I think it's just driving home a point. And I've talked to many patients about this, and I think Aimee has also. It's like, sometimes you just need to, you know, cut your losses and jump ship and find another ship to sail with, right? That's going to get you the resources and the results that you're looking for. So that's all I, you know, kind of wanted to push there.
And you know, I totally agree. And you know, one thing I always say to clients I work with is, you know, I'm part of your team now. So I'm on your team, and I'm cheering for you. I'm rooting for you. I'm going to give you the best of what I've got to help you get to where, you know, to help you reach your goal. Right. And if you don't feel that way with your doctors, or you feel like you're just a number, fire them immediately. Be your own advocate. Don't be scared. I understand some can get caught in the insurance thing. Like, well, this guy takes my insurance. See if you can find someone else in the practice then.
Right.
Speak up for yourself. You know, you want your doctor coming in and remembering your last cycle, or whether you had a miscarriage last year, or how you responded to certain medications. And you want them to be going to bat for you. So we want to be looking, you know, we can go right into it right now. It's like, because we have things that we're going to mention to you guys, but they should be looking at your thyroid numbers, and they should be monitoring them regularly, especially when you're cycling, because the meds that they're giving you can throw off your thyroid. And if your thyroid is not where it's supposed to be, pregnancy is really hard to achieve. And so that could all be in vain. You know, I always say, I've had girls that are about to go for a transfer, and they're like, oh, my TSH came back at a 4. And I'm like, cancel the transfer.
Yeah.
And they're like, no. I'm like, no, you have to cancel the transfer. You're not going to get pregnant. And if you do, you're going to miscarry. I hate to be that blunt, but that's the truth, you know? And so I'm not taking that risk, and I don't think you should take that risk, and your doctor should have been checking it, you know? And listen, there's plenty of doctors I love, and then there's some that I would like to, you know, trip if I saw them in the street, but in a loving way. But that's their freaking thyroid, you know?
Right.
So that's part of how you want to advocate for yourself. And, you know, basically you want thyroid antibodies checked, right? And you want your TSH to be between a 1 and a 2. Your antibodies should be, I think, 10 or lower, right? Mm-hmm. They should be non-existent. I'm going to blank on where you want your free T3, free T4, both checked. Mark, what are the ranges? They should be kind of in the middle, closer to the.
Yeah. So I think the easy rule of thumb when you're looking at lab work without getting into each lab test and their values is to say, you look at the big range and you want to be, you want cut off the bottom 20%, cut off the top 20%, and you want to be in that middle 60% ish, right? So like that's the easy rule of thumb, right? If you find yourself on any extreme, then that's where I think red flag starts to come up. And I think that's easier for you as a listener and not a healthcare provider with, an understanding of all the lab tests and everything. I think that's easier, like a general way to focus on lab work is to take that as your rule of thumb. And thyroid's definitely an easy case for that. I know, based on what Aimee just said, I agree 100%. I think those cycles should be canceled and moved on to another thing. I know for all of you as a patient going through it, that's a hard decision to make, right? Because you've already allocated time and resources and energy into getting this going. When we say that to you, it's because we're just looking out for your best interest, and we know that it's hard, but your goal is a pregnancy and a healthy child and delivery. And so, we're looking at that. So it sucks that you've got to cancel a cycle and move it on to the next cycle or the cycle after that. Totally sucks. Recognize that. But it's in your best interest to do that, even though it's not ideal for you at that moment.
Yeah. Agreed, 100%. And I love the way you broke that down with the ranges. That's super easy because sometimes I can't memorize all the numbers. But yeah, it's, and I think the other thing too, especially when talking about the thyroid, is some of these girls, right, their numbers are within range, right? That it could be, say a TSH at like a 3 or even a 2.5, right, where it's a decent range. But if you have a lot of symptoms of a thyroid condition, pay attention to those and nag your doctor about it until I'm not a huge pusher of any medication, but when we're trying to get pregnant, I always say the fastest approach is for you to get on a thyroid medication if we need to. I can fix your thyroid after you have the baby. But in a lot of times, getting pregnant will reset the clock and itself out. But if you are dealing with thyroid symptoms, either hypo or hyper, or they flip in between, that's a clear-cut sign that there's probably some Hashimoto's going on, which is autoimmune thyroid disease. But your symptoms should be your telling point. So if you're doing everything and you're following the diet we tell you to and the supplements and you're sleeping and you're doing all these things, if you, someone just knocked on my door. Sorry.
Yeah, it's okay.
I'm in the clinic right now. So, but if you're still walking around and feeling like crap or you're not feeling like yourself, then we need to be monitoring that more closely.
Right.
And your doctor needs to be in that loop because I want you feeling really good when you get pregnant. That's just going to be a sign of a good, healthy pregnancy.
Yeah, that's 100% accurate. I mean, and I go ahead. And I agree, when it comes to medication for thyroid issues, like sometimes it's not, it's maybe not the preferred, but sometimes that's what's needed right now. It's the safest and it's the healthiest to get you, pregnant and have a healthy child. It does sometimes mean that you've got to be on medication. And, even though you might not want to, that's what we got to do. So, we're just looking for the best plan to support you right now in the most natural and healthiest way possible.
Yeah, exactly. I love that.
So Aimee, if patients have had a miscarriage, let's just keep it simple. If patients have had a miscarriage, when do you think they should start to get tested, and what would you recommend?
Well, I used to say, like, oh, one miscarriage, 18% of women have a miscarriage, so it could be totally normal. For me though, even if it's just one miscarriage, I want you to ask your doctor for some testing. You should have your cycle day 20 or 21 progesterone tested. You should be tested to see if you have the MTHFR genetic mutation. Mm-hmm. I'm even more inclined these days, and I think it's because we're getting the more complicated cases to push them for the clotting factor test. A lot of doctors give the patient pushback on that because it's like 18 vials of blood. And, I think 90% of the doctors can't read the results, which is why they push back on it. I can't read. I'm not bragging. I have a hard time. I have to sit and like Wikipedia and, like check it all out. But the bottom line is yes, miscarriages happen and they suck. But we don't want you to have another one ever again. And for sure, if you've had more than one miscarriage, these tests need to be done. I would even go as far as thyroid antibodies should be checked.
Mm-hmm.
Some doctors will look into like natural killer cell count. There's other immune tests that can be done. You could research. There's a doctor that I love to work with, Jeffrey Braverman. Preventmiscarriage.com is his website. He does free 20-minute consults, and he kind of does a history, and if he sees any indicators of past family history of autoimmune conditions or signs and symptoms of autoimmunity, then he'll recommend these immune markers, and so we can find out is the miscarriage happening because your body's rejecting it, or is the miscarriage happening because it was bad luck or it was poor quality? Those are kind of the three reasons, I think. And if it was one of these like clotting factor issues, it's kind of an easy fix. We can do baby aspirin, we can do Lovenox. It's a blood thinner. It saves lives, literally. But so I've become, I think in the beginning I was a little more lax, not entirely, but one miscarriage, maybe I was like, okay, probably won't happen again. Now, even one miscarriage, I want those tests because a lot of times it's the MTHFR, right? What was the same? If you have that mutation, it's going to be hard for you to hold a pregnancy, basically, if you're not getting the right support and the right supplements. And folic acid should not be in any of your vitamins ever. It should be folate, methylfolate.
Yeah.
No folic acid. So yeah, I mean, and what about you, Mark? What's been your experience, and where do you draw the line?
I think for me, for sure after 2, I'd never wait till 3 unless they've come to me at 3, right? But for sure after 2, I think for me the difference between deciding if I'm going to do that extensive testing after 1 or 2 is if they were able to test the fetus genetically, depending on what those results were, right? If we know that there was some random genetic abnormality, then I might not do some of those other testing. But if they weren't able to test it, or they didn't know, or those results didn't come up, right, everything was normal, then for sure I'm going to reach out and say, okay, these are the things we need to do. And there's tiers. You can start with like the first tier of like more common blood clotting factors, more common autoimmune issues. And then if those come back normal, then, what do you do next? Do you just say, okay, you know what, we're going to wait and hopefully we fix some things, or maybe now it is time to check that second tier and more, I'm going to say random, but less common issues that come up. And I have a patient that I think of who I'm working with right now. When she came in, she had 1 miscarriage. It was just her history that made me question. And so I said, I do think we need to have these things tested. And so we tested them. Fortunately, they all came back negative. And while we were testing, she got pregnant, and now she's into her second trimester. So, but we started that process because I felt like it was important. There is something. I think the biggest reason why is because there's this out-of-pocket expense, and it's not inexpensive to have these things tested usually if insurance isn't going to cover it, that, everyone's trying to balance, cost effectiveness of should.
The clotting factor test is like a $300 test, to prevent a miscarriage. I think it's a no-brainer.
Yeah.
But I agree. And if there's a family history, of any clotting factor disorders or something like that, or a family history of autoimmune conditions, and you've had miscarriages, for sure, these immune panels need to be done.
Yeah, absolutely.
And again, to find the right support, I always recommend people to Braverman because he does those free 20-minute consults, like similar to Magarelli, where, and I think Magarelli would be looking, under the same rocks, but he can pretty much just take a history and figure out like, yeah, you probably have, and then he'll do further testing. And he's not inexpensive, unfortunately, but there are other doctors you can work with. And, to not underestimate, like if someone said, oh yeah, someone tested my factor 5 and I had it, but the doctor told me not to worry about it. Worry about it. It's no joke, the very least, put yourself on a baby aspirin every day, tell someone in your medical team, but at the very least, you're doing that,
I think that with these autoimmune and blood clotting factors, there's certain physicians that are going to be better suited for you than others. And some, they'll get those results and be like, no, it's not a big deal. There's not enough research around it. And others, like, that's what their practice is all built around. I have a physician locally, relatively locally, similar to Braverman, that I refer to for things like this when I need that research, because most of the other clinics in town really just ignore it, right? It's just not what they focus on. And part of it is because there is not enough research. So they're so research based on how they make their decisions, right or wrong, that's just not going to be their focus. And so you do need to, I think this for me kind of comes back to being your own advocate. If things come back abnormal, don't let anyone tell you that that's okay or normal. It's abnormal for a reason. So you've got to then seek out the right support, and you're going to be your own best advocate for it. Whether it's during, trying to find out what's going on, or even in the middle of an IVF cycle. Like, I can't tell you how many patients tell me the clinic's not answering my questions. They're not calling me back. They're not emailing back, whatever it is I don't know what's going on. You're paying them enough money. You deserve to get answers. Don't worry about bothering them.
Yeah.
Pick up the call, email again until you get the answers that you deserve. Bother them. It's okay. Yeah.
Agreed.
Yeah. So, I think that's really like those are the big things that Aimee and I wanted to talk about. We're just looking at our time to make sure we're at our point and we're okay with it. I know, Aimee, we both wanted to talk about, being a detective.
Yeah.
A little bit. Do you want to just touch on that as one of the last things we hit on?
Yeah. I think that comes with, some of these blood, the blood work that we've discussed, and, but so much of it is you being in touch with you. I think another thing too about miscarriages, that this is something I've noticed and talked to Braverman and his team about it, is if you are pregnant and before you miscarry, or the second you do get pregnant, you break out in a rash or hives, or you get flu-like symptoms, you're having basically an allergic response to the pregnancy. And so chances are there's an immune system, to be very blunt, pregnancy is the only parasitic infection that our body doesn't kill.
Right.
I love that sentence. I kind of love saying it. I also hate saying it, but it's really curious. It's very interesting. Our immune system says, well, this is foreign. I'm supposed to attack anything that's foreign, but for some reason there's a communication that happens and we don't totally understand it. And the body says, I'm going to keep this. I'm actually going to keep this baby. And then when there's a patient that maybe has an autoimmune condition, or their immune system is acting wonky, that communication doesn't happen, and either the sperm gets rejected, the embryo gets rejected, ovaries can get rejected, right? And the body can attack itself and any foreign pathogen. So if you get symptoms like that, or or feel very ill, there's one thing to have morning sickness, but I'm talking about like it's clear cut, like, I probably implanted this week and I broke out hives everywhere. Okay. That's, something else to look at. And so that's where some of the detective work comes in. And that's where Marc and I can pick that stuff up with, because we spend so much time with our patients. Your doctors, Magarelli touched upon this. It's like, they have like 7 or 9 minutes they can spend with you before they then cross the line and have to start charging more for their services, because they have to meet a quota every day of patients in order to cover their expenses and their ends. And I get that, so not every doctor is going to pick this up or start to put the pieces of the puzzle together. And so you have to be your own detective too, and keeping really good notes, like, how do I feel? And we see it all the time in the clinic, right? It's like a very basic example is, taking gluten out of your diet. And then within a week or maybe 2 weeks, typically you go through a period where you don't feel that awesome. And then all of a sudden you're like, I
feel better. Yeah.
feel clear. I wake up feeling rested every morning. My bowel movements are awesome. Like, you didn't realize how kind of off you were until you made these changes. And so it's the same type of thing. We want you to see, and that's a lot of what I teach, in my book and my e-course, and Marc as well. It's like, I want you to tune into your body, and I want you to notice how your health is changing and shifting. And then that's a clear-cut sign that your fertility is changing and shifting, which they're not separate. They're totally related. And so, we're going to do our best work in this masterclass to give you the tools, to become your own detective. But you really need to, I would say start journaling and notice all your symptoms and how you feel. And then notice how they're changing and when you support your body in the ways that, we're all recommending. And bring that up with your doctor. And like Marc said, keep calling until they answer the phone and if they don't have time to have that conversation, then one thing you can do to get more support on your path is talk more about what you're going through. And I guarantee you someone in your circle knows someone who's gone through it and has a doctor to recommend you to. And, so to not stop searching, because, I had a patient in earlier today and she's in menopause now. They adopted 2 boys. She went through IVFs that didn't work. Right. And, I was just curious. And so I was asking some questions. She's emotionally, healed from it. Right. She's got these 2 beautiful babies now and she's great. But it sounded like it was a treatable, it sounded like she had a clotting factor disorder and that no one picked it up, and so she went through too many miscarriages. Right. And they decided to just call it quits.
Move on.
And, I get emotional thinking about it. She's okay, which is the most important thing, right? And they have these 2 beautiful babies, but someone didn't look deep enough, right? And I don't want that to be your case. I want you to become, like your detective and then find someone, we're trying to clone ourselves. We'll see how it goes. But like someone like us that can help you be your detective, that's what you need, is like someone who's going to sift through all of this with you and say, that's curious to me, that shouldn't be happening, or, that. Yeah. So, and like, like to be totally redundant, you need to find those people and have them on your team.
Yeah. Well, and I think part of being a detective is having all the information you need. So having all copies of all your lab work, your history. I can't tell you how many patients come in and they don't have any of that. And if there's one thing, regardless if it's fertility or not, that you should always have at your fingertips is, what are the results of my lab tests, right? Because you always want to be able to look back and see a chronological progression of where things were at historically. So you can see, oh, this is where I was and this is where I am, where do I need to go, sort of thing. So absolutely, that's part of being a detective, as well as just at least having all the right information in front of you to look at and give to others, right? So when you walk into whoever's office, you have all that to give so they can give you all the information right there.
And then you can even gauge, like, how was my vitamin D level this year in comparison to last year? What did my thyroid look like? My blood sugars, my A1C, right? And notice how things are changing or shifting. And, again, it puts you in the driver's seat, to be your own advocate and to really understand your body, its mechanics, and how it's working,
Yeah. Well, we want to thank all of you for taking the time, certainly to watch this first segment, but hopefully that means you're going to watch all the others after it. And we really hope that this brings you a lot of information, resources, tools, and empowerment to reach your goals in 2017. We look forward to seeing you all in our Q&A later on today. And as a special kind of gift and bonus to all of you who purchase the whole recordings, all the recordings to watch at your leisure, Aimee and I are doing 2 live Q&As within the next month for all of you to be part of, and for us to just be an added resource to all of you. So hopefully you can join us for that as well.
Yeah, we would love to see you there and help you however we can on this path.
Yeah.
So use us.
Use us as a resource. Enjoy the rest of the day, and we'll see you periodically throughout the day, and hopefully for sure at the live Q&A. Have a wonderful Saturday and weekend, and enjoy all the wonderful lectures that we're here.
Take lots of notes, lots and lots of notes.
Okay, all right, everyone. Bye-bye.
Here we go.